Imagine this. What would happen if you were bitten by a snake in the wilderness and there is no health facility nearby to rush to for treatment? Now, we came across a case of a child who was bitten by a snake in a remote area of Tiati constituency in Baringo County, but her life was saved because there was a health facility within a walking distance.
If this facility could not be here, the child could be in danger.
How is this related to devolution of health services in the country? Find out in this two-part series, Health in Devolution, that begins today, and we will be looking at the milestones so far, the challenges and the way forward. But first, the Cabinet Secretary for Health, Dr. Cleopas Mailu, gives us an overview of the levels of health facilities in the country after devolution.
Where the common man is, we have a dispensary. A dispensary is managed by a nurse. It has no inpatient facilities. It has no delivery facilities, in other words, bed capacity, but is able to deal with the minor cases. If you come to the health center, that is where you'll find a clinical officer. There are beds for delivery, 6 beds for delivery, and therefore it has a bit of inpatient and providing a little bit more services which are not found at the dispensary level. Then after the health center is when you come to a sub-county hospital, which we used to call sub-district hospitals. And those have doctors. Some of them can be teaching institutions for internships and all that, or for KMTCs. And then the county referral hospital, which for some, they are huge hospitals. Those who inherited the former provincial general hospitals, but there are others who inherited the former district hospitals, which are converted now to level 5. Level 6, of course, is Kenyatta National Hospital, Moi Teaching and Referral Hospital. We have Mathare Hospital, which is a special hospital for mental illnesses, and we also have Spinal Injury Hospital. And those are having universities for teaching, research does happen there, and high-end or tertiary care.
Under the devolved system of government, the Ministry of Health sets the policy. It sets the standards, quality of healthcare, and it is in charge of the regulatory framework to ensure that health workers and institutions, whether public or private, play by the rules. The county governments, on the other hand, are in charge of service delivery at the county level.
Now we have got free primary health care. The government removed user fees for any Kenyan attending health center and dispensary to be seen and treated. There's no fee required to be paid, user fee. Then we also introduced free maternity to allow mothers to deliver in any public institution, including Kenyatta National Hospital, for free.
Where free services are expected is only in health centers and dispensaries. The national government has never fully funded the county referral hospitals.
Now, I'm at Nakoko Dispensary in Tiati constituency, Baringo County, to find out if the existence of such a facility that was constructed 2 years ago has had any impact on the community. Here, we found a child who had just been treated for a snake bite. The nurse, Boniface Ambani, who is the only health worker here, tells us that snake bites are common in this area.
If this facility could not be here, the child could be in danger. Because of that, traveling up to the district hospital, it is far away. So this facility being near, it is of great help to the community members.
For the County Executive Committee member for Health, this is a positive sign of the impact of devolution of health services.
People migrate and they run away from the health facilities in case of insecurity. But so far, so good, because people come closer to the health facility. Imagine people can move their animals closer here so that they can access medication. And so those are some of the positives and negatives also, equally. In
Tiati constituency before devolution 3 years ago, there were only 2 government health facilities and 3 non-governmental. Now there are 13 county health facilities and 7 sponsored by religious organizations.
Initially we had 1,084 staff, but we have added 155 new staff.
In the neighboring Baringo South constituency, there was an incident recently in Mukutani ward whereby 52 people were hospitalized after consuming uninspected meat. All of them survived thanks to gifted hands of a single nurse at the newly established local dispensary.
IV fluid was being hung on branches of trees, and that is acceptable here, because what the people feel is that they should be treated under the shades, because the temperatures in the rooms are unbecoming. They're very extremely hot. They go up to around 45 during the day.
Still in Baringo County, we move to the county's referral hospital, which has undergone a major facelift following many years of neglect.
If you talk about this maternity, the numbers are increasing progressively over time. If you compare between 2012-13 and now, initially we used to do about 130, 140 deliveries per month, but over time we're doing up to 200 deliveries per month.
Kila kitu ni sawa, but problem penye naweza ona kwa nini tukikuja madawa tuseme kama watu wakubwa hatuwezi pata, unaambiwa uende kama ni private, for example kama ya typhoid wasipati, but ya mtoto nikikuja huwa napata.
Sometimes you may not have all the drugs that you require, but that is a work in progress. We are working in collaboration with the county government to ensure that apart from the essential drug list, we also have other special drugs.
In Bungoma County, one of the milestones in the devolution of health services is the establishment of this pediatrics hospital. It is part of the Bungoma Referral Hospital.
The change is that there is space, we have enough beds, we have enough doctors, consultants, we all have doctors 24 hours.
Tulikuwa tumefinyiwa sana. Unaweza kukaa na mtoto kwa laini kuanzia asubuhi hadi jioni hujapata matibabu. Lakini change yenye nimeona saa hizi ni kubwa.
The laboratory at the referral hospital has received the certification of the International Organization for Certification, ISO.
Initially we were limited, we had limited resources and we were not able to do many tests, but with the devolution we were able to increase our test scope. We were able to add more tests that our patients used to go to private hospitals, they used to go up to Eldoret for those tests to be done.
In Bungoma County too, the staff are overstretched. The current 1,600 health workers are not enough, according to the County Executive Committee member for Health.
We inherited 1,600 members of staff, out of which we have had some exits. And we have just maintained that number by replacing those who have exited. The reason we have not increased is because our budgetary allocation cannot allow.
Before devolution and now, a number of things have changed. One is that we have acquired new machines through MS. Two is that these machines have helped us to reduce patients' waiting time. Three is that we improved the quality of our services.
In Bomet County, let's begin with views about service delivery in the health sector after devolution.
Sioni mabadiliko kabisa kwa sababu sahii bado tumepata shida mingi kwa sababu ukienda ukipeleka mtoto kwa hospitali kitu tu yenye unapata ni Panadol.
Imekuwa karibu na wananchi. Hata kuna mahospitali ambazo zimeanzishwa kwa vijiji.
The service is worse than before.
Mgonjwa alikuwa anakuja na maji yake. Na hiyo maji tena ilikuwa mbaya kwa sababu unaleta kwa mtoni. Hiyo si mzuri. Lakini sasa hii maji mingi, dawa iko mingi, daktari wako busy, cleanliness.
We sought to find out what exactly has changed at the county's main hospital.
In 2013, this hospital did not have enough beds. This is a 144-bed hospital, but there was a shortage of beds. So what has happened over time is the improvement in the number of beds. Up to now, we have more or less enough beds, few shortages here and there. Now we manufacture our own oxygen, and it is piped to all the clinical areas. All the wards have now piped oxygen. We have about 21 patients on regular dialysis and about 9 to 10 patients on emergency dialysis at any given time.
At this hospital, despite a notable increase in the number of health workers since the inception of devolution, the staff are overstretched.
We have machines, but we don't have enough staff.
The health facilities that we found were 90. We've increased them to 129.
So, from the counties featured so far, it is clear that understaffing is a big challenge that could reverse the gains in devolved health services if not addressed.
We need a health services commission, which is a standardized structure to manage healthcare, and then we need increased budgetary allocation for healthcare. Just two things.
Those teething problems we are overcoming. But the problem is not over yet, because there are promotions people are claiming, career progression, there is people going for training, and this movement between counties to other counties of health professionals. We haven't gotten it right, but there's improvement which is coming.
Several workers have actually fled the counties, and even the national government. In total, doctors only, we have lost 2,000 doctors.
Now, the numbers are not adequate too. There are counties which have very few health personnel. They advertise they are not able to attract health personnel. And that is a problem we have to look at.
We take a short break. When we return, we will bring you more from other counties right after the break.